Good morning, Rita. How are you today?
I'm good. How are you?
I'm good, thanks. My name is Pradeepa. I'll be your trainer for today. So this is a role play that we are doing for TAEDEL402, and this is the coaching session number 2 for hand hygiene technique using alcohol-based hand rub. So Richa, today we are going to have a session with regards to hand hygiene techniques. Are you prepared for it?
Yes, I'm excited.
Okay, lovely. So I will just go through basic introduction. So so what are you doing? What's your experience?
I am just starting my new grad position at TAEDEL402. So I've worked there for a week, and then my educator has sent me for this training.
Okay, lovely, very good. Welcome to the new hospital.
Thank you.
And I am working as a trainer, and I have been employed to do the hand hygiene techniques in this hospital for the new staffs and the new grads. So other than that, a few housekeeping rules. So basically you have your fire exits where outside, as soon as you enter, onto your right side the green man running is your fire exit, and it will lead you down to the main street of the hospital, and at the end where the news agency is on your left side of the end, that's where your assembly point, emergency assembly point is. And when you go outside, you can see that there are flip charts and emergency evacuation diagram there, so you can guide as well. Next would be your toilets. So from this room, just outside, as you can see, is your toilets, and onto the left side is your tea room. And so just the basic housekeeping rules on top of that is, if you can just turn off your pager, please. I've turned off my pager, and I've put my phone as well in silent mode. So if you want to attend any phone calls, you're very well welcome. You can just let me know, and then I will just, you can go outside and you can attend the phone call. Then moving on, the aim of this session is to learn the hand hygiene techniques using alcohol-based hand rub. Because your ward is a gastroenterology ward, your manager was having a talk with me. She said that there's a lot of infectious patients in your ward, and hand hygiene plays a major role in order to prevent infection from one patient to another, and from patient to worker, and from worker to worker as well. So we are kind of at the moment paying a lot of attention to the hand hygiene techniques. So I will just go through the content of the session as well while I'm going through the slides. On top of that, so this is the context of doing this session, and so the learning plan is going to be, you should have by now done a prerequisite online module that I sent you as an email, and you have done that one?
Yes, I've done it in my my health learning.
Yes, very good, well done. Okay, so I saw you sending the certificate to me through the email as well. That's very good, that's well done. So this is going to be a face-to-face session, and after the face-to-face session, we will be doing one session today, 20 minutes, and again we both will be meeting at the same time next week, same day, to do the second session. It is just going to be a reinforcement of the same session to make sure that the knowledge has passed on. So that would be any questions until here?
So this will be my practice, and then the other will be my competency, or?
No, we'll do the competency today as well. Once you do your practice, you can do your competency today, but then we'll have ongoing competency assessments as well. Okay? So I noticed that you have done your VAK learning style assessment, and when I assessed or by looking at all the answers, you are scoring more towards a kinesthetic learner, and secondary you are more of a visual learner, and then one is more of auditory. So I'll try my best to give more exercises and demonstrations and let you practice hands-on, so that it's easier learning for you. So that's the reason why I've given you a notepad as well for you to take notes, so that it's easier for you to understand what I'm talking. Okay, good.
Thank
Lovely. So just to encourage the visual learning, I've made some PowerPoint presentation, plus I've given you a handout posted as well for you to visualize the steps while I am doing the demonstration. You can look here and you can just compare it as well. Okay? Lovely. So with work health and safety, is there any injuries that I need to know? Like, do you have any issues that I need to know that's going to interfere with your learning? Are you okay with using the alcohol-based hand rub?
Yes, I'm
you okay?
Yes.
You don't have any allergies to this?
No allergies.
Okay. Lovely. Because the alcohol-based hand rub can make your skin really dry, I've given you a hand cream as well, so that is part of your learning. So when you use alcohol-based hand rub, and you have to maintain the integrity of the skin, you need to moisturize your hand nicely as well. Okay. Just for the sake of this learning at the moment, I would like you to be bare below elbow, so no rings, or if you have a wedding ring, it's okay as far as it rotates around. Okay. Yeah.
Okay.
But no bracelets or watches.
Bracelets.
Oh yeah. Thank you very much for that.
Yeah, and I've got a wedding ring, so
that's okay. As far as it rotates around, that's fine. Yeah. So what happens is, after our session today and after next week's session, you will be having ongoing assessments happening in your ward. So you need to approach your manager or your CNE to get your competencies assessed on day-to-day basis with hand hygiene techniques. So do you work rotating rosters?
Yes.
Oh, okay.
Yeah. So last week I was all supernumerary. Had supernumerary in the day, full week of morning shifts.
Good.
So now I'm going to start PM soon.
Oh, okay. So just to keep that much more easier, your manager will discuss that with you. So I've requested your manager to put you on all morning shifts for the next 2 months' time until all our competencies are kind of get done. So in case if your CNE is not on the floor, she is on a holiday or an annual leave, how are you going to get your assessment done? Who would you approach?
I've had some after-hours educators come in, and then they were also introduced in orientation.
Lovely.
We could approach them.
Okay, that's good then. So you have some resource to approach. That's very good. So during this session, I'll be asking you a few questions just to see whether the knowledge transferring is happening. So if you have any questions as well, you can throw it at me and I can answer those questions.
Sure.
I would like to emphasize that this hand hygiene technique is going to be a part of your career development as well. I understand that you're in the early stage of your nursing, but that doesn't stop you for anything. You can still become a link nurse of the ward. The link nurse means that you will be linking between the ward and the infection control board, because you're learning hand hygiene. You can be a role model for other nurses and doctors and other healthcare professionals, and you can teach them the right techniques, as well as you can become a hand hygiene auditor. All these things can go into your portfolio when you want to apply for other jobs or other positions that comes inside the hospital. So you can become a champion of the ward. You'll be really valued for what you're learning today by the organization. Are you happy with that?
Yes.
Lovely, that's so good. Okay, so let's move on to the session. So I'm going to talk about hand hygiene using alcohol-based hand rub. Okay. So today the aim of the session is going to be to learn hand hygiene technique using alcohol-based hand rub, and this is alcohol-based hand rub. There's another hand hygiene technique where they use soap and water. When do you think they would be using soap and water?
When your hands are visibly soiled.
Soiled, very good, well done. So this alcohol-based hand rub, you would have seen it in every point of care. At the bed end of the patient, outside the room, in places where you need to do a hand hygiene. So when your hand is not visibly soiled, you can do a alcohol-based hand rub. It is equally as effective as a soap and water-based hand hygiene. But But if it's visibly soiled, yes, I agree, you have to use the soap and water hand hygiene technique. Alright. So today's content is going to be, we will be quickly looking into hand antiseptics, then 5 moments of hand hygiene and the glove use, reducing infection rates through better hand hygiene techniques, the actual hand hygiene technique itself, demonstration of the hand hygiene technique by me first, so you would watch it, and then I would ask you to do it like practice, then I will do a competency assessment when you are ready. Okay? Sure. And finally, would be the conclusion where we'll have this question answer sessions, and then you can do an evaluation form and the feedback about this session, and also the assessment will be part of that. Okay, good. So hand antiseptics, as you can see the Avcard, that's your alcohol-based hand rub. Okay, and the next one, as I said, is going to be your chlorhexidine-based hand wash with soap and water, and it's going to be your general soap and water. Okay, so today we'll be using the alcohol-based hand rub. So the 5 moments of hand hygiene when you are looking after patients are going to be first would be before touching the patient. Okay. Second would be before cleaning or before any aseptic procedure. Okay.
Before doing anything for the patient.
Yes, before touching the patient, and second would be before doing a clean or an aseptic procedure. Okay. Third would be after body fluid exposure risk. So you have like you are wearing a glove, but still if glove is just like a fake protection for you. You would still do a hand hygiene after removing the glove. Okay. So because it could still you would have some kind of an exposure, we would like to not to carry anything for yourself or to others. Right? And after touching the patient, like before touching the patient, then after touching the patient. Next would be after touching the patient's surroundings. The bugs doesn't just live on the patient's skin or just on the patient. Anything that the patient touched, if they are having some kind of contagious infection, yes, it's the bug or the microorganism is going to be on all the surroundings that they are going to touch. So if you are touching, if the patient has touched this computer, and if you are going to touch this computer, the microorganisms can pass on. Yeah. And without hand hygiene, if you are going and touching somebody else, you can be a carrier and you can give it to the other patient. Okay? So hand hygiene between is very, very important. Can we move on? Yes. So hand hygiene and glove use. Especially in a hospital setup, gloves are readily available. It is not just to protect you, it is also to protect the patient. So if at all you're using a gloves, so before putting the gloves you have to do a set of hand hygiene. You put the gloves on, you are doing something for the patient. You remove it, you have to do a hand hygiene again, because inside the gloves the environment is really ideal for the microorganisms to grow, because it gets sweaty, it gets moistury, so you have to do a hand hygiene after removing your gloves, and same before putting the gloves as well. Okay. So gloves use does not replace any hand hygiene action. So reducing infection rates through better hand hygiene. How we are reducing the infection rate using better hand hygiene is, as I said, we have done a lot of studies, and a lot of experts have done researches where they have seen the infection rate in the hospital, and by putting as hospital-based hand rub, alcohol-based hand rub in every point of care, and training the nurses and all the healthcare workers on proper hand hygiene techniques, they were able to redo the infection rates, and they found out that there was a really big low level of infections getting spread among the patients and in the hospital. So it's pretty much proven fact that hand hygiene helps in reduction of infection, because hand are the carriers If you don't do proper hand hygiene, as I said before, we can take the microorganism from one patient to another, or from one worker to another, or from worker to the family, and the infection can spread on. And especially in the COVID situation at the moment, we need to be very careful regarding spread of infections. Any questions have been here? Okay, thank you. So, hand hygiene technique, I've given you a pamphlet as well, hand hygiene technique. So, we will go through the 10 steps. You can do it along with me, or you can observe and we can do it together, or you can follow it after me. Okay? So, I will just demonstrate the hand hygiene technique. So, bare below elbow, nothing. Okay? No, I don't have rings, but wedding ring is allowed as far as it can be rotated. So, just squeeze cup full of alcohol-based hand rub. 1, 2, palm to palm. 3, over the palm. 4, 5, thumb and the bit. 6, 7, 8, 9, 10. Do you know?
This is what I was going to ask. Do we need to do the wrist or
Yes,
not?
yes, we have to do that. So shall we do it together?
Yes.
Yes.
Okay. So 1 full.
Yeah. 1,
So 1,
1, 2, 3, 4, 5, 6, 7, 8, 9, and 10.
Do I need to do a bit more with my ring?
Yeah, you can rotate it around because you've got the ring there, okay? And you can keep your nails short and nice and clean, okay? You can tell me when you're ready for the competency.
Maybe one more go. And
Okay,
then
alright. No worries.
So a big scoop in.
Yeah.
Then
You can teach
1,
me, yeah?
And we go another side 2.
Mm-hmm.
Then we do above.
Yes.
3. So in this we go a number one.
Yes.
Step,
Yeah.
right? And then 4 the
Yeah.
other side. Then we do the thumbs. 5, 6. Then we do the nail bits. 7, 8. Just do my knee as well. And then the wrist. 9, 10. Okay, good. Still getting dry. Okay, I'm ready.
You ready? Okay. I'm just going to mark you down. Alright.
You want me to start?
Yes.
Okay, first I just took a full scoop. So 1, 2, 3, 4, 5, 6, and then 7, 8. Just a minute as well. And the wrist, 9.
Very good, Richa. Well done.
Thank you.
Lovely. So today you have done a practice session plus one competency assessment done for today, and you passed your competency assessment for today. But just for the ongoing practice, what we are going to do is we will have like another, next week we are having another session as I said before, then your CME. Okay? So throughout every time you are going inside your ward, your CME
This
is
is a
going to be
message for
there.
all staff to
Sorry,
remind
just
them
wait
that
for the
Thursday the
announcement.
10th of September is Are You OK Day. Now more than ever, we need to check in with our colleagues, family and friends. Tomorrow, look out for activities and information promoting Are You OK Day.
Sorry, that's just an announcement. Okay, so we are meeting next week, and then with the Whenever you're shifted on, when you are doing a hand hygiene technique, you just ask your CNE to assess you, to come and assess you at least once in a day to make sure that the practice is ongoing and the knowledge is not getting lost. So once you start doing it every single time, it will get embedded inside you. Okay?
Sure.
Cool. So any questions do you have?
Just with the cream, like say my hands are dry now after using the alcohol, can I immediately use that cream?
Yeah, after you finish your patient care and you come outside the room, you're doing the alcohol-based handle. After it dries out, you can use your hand cream. That should be fine. If you have your own hand cream, that's fine. Or if you have a hospital one, that's also fine. As far as you're not allergic to it. Okay. Do you know where all your alcohol-based handles live in your ward?
Yes, I've seen them at the end of the bed. Good. On the patient's bed.
Very good.
And then I've seen it on the corridor, just out of the rooms, whether it's single room or double room.
Yeah.
So they've been there and on the desks.
Okay, lovely, good. So if it's empty, do you know the ordering process for it? How do you order it?
No, I only get it from the store.
Okay, that's okay. So, but if you run out of it, if you can't find it at all, because it's very important that you need to know how to order it as well. So usually the pharmacy delivers it, so you need to put an order in through your team leader, but the after hours manager can get it as well from the pharmacy. So we can get it from them and we can use it on the ward if you run out of it. But this is very, very important. Okay. So you have my email ID?
Yes, I do. Yes, because I sent you that certificate.
Okay, lovely. Okay, good. So you have my email ID. So any questions, you can send an email to me. You have to be in touch with. We have to be in touch with each other, so that this is an ongoing learning process. And I've got my phone number underneath it as well. You can call me if you're not able to attend the session. You want to let me know. You can let me know ahead, or you can let me know later on as well. That's fine. But just notify me if there is any issues. Yeah. So we'll be meeting next week. Before that, there is an evaluation form I want you to fill up for regarding the session, please. So that's your evaluation form. Yes, that's like a feedback form for you. You have to just do a feedback regarding the session, how you felt about it. There are a few questions you just need to fill it out.
Okay, sure.
Thank you very much. And
I'll get your pen because I've only got the pen.
oh, okay, that's fine. That's okay. And
Thank you.
I hope it writes well. So actually all the references for this session was taken from the Clinical Excellence Commission, which governs the hospital, all hospitals of New South Wales, plus the infection control policy of your hospital. Do you know how to access the infection control policy and services in your ward?
I know how to access the policies.
Yes, good, very good. And then I've used the hand hygiene competency tool that is used by the hospital as well, which your CNE will be using as well.
Okay, sure.
I think that's pretty much it. And lovely, thank you so much. I let you fill up that form for me.
Okay, I'll just get the session title.
Session title is hand hygiene using alcohol-based handle. Okay. Thank you, Rija. I'll meet you next week. I'll let you fill up the form.
Thank you.
Thank you.